Welcome to the deep dive.
Great to be diving in again.
So today we're tackling a subject that's, well, incredibly important for global health, but it often kind of flies under the radar.
You don't always see it in the headlines.
Exactly. We're talking about veterinary medicine and specifically its essential role when we think about emerging zoonotic diseases, things jumping from animals to humans.
And we got some really insightful sources for this one, all centered around an expert who's actually been on the front lines.
That's right. Our mission today really is to unpack how diseases like COVID-19, like Ebola, don't just cross species. They cross a line, as our source puts it.
The line between manageable and catastrophic. That's a strong phrase.
It really is. So this deep dive, it's basically your shortcut to understanding that vital link and, what it all means for global preparedness.
Getting ahead of the curve, hopefully.
Hopefully. So the expert at the heart of these sources is Dr. Gurma Kabay. He's a veterinary public health specialist.
And he's got, 15 years of frontline experience?
15 years, yeah. Particularly dealing with zoonotic outbreaks across East Africa. So his practical insights, they really form the backbone of what we're digging into.
Real world stuff.
Definitely. Let's start with COVID-19. That's probably top of mind for many people.
Understandably.
So Dr. Gurma was advising Ethiopia's COVID-19 task force. And during that time, he identified what he called 3 critical gaps.
Gaps in integrating veterinary expertise into the response, right?
Exactly. He pointed specifically to, a lack of early diagnostic capacity for animal links, not enough cross-sector communication.
Meaning vets and human health folks maybe weren't talking enough.
Precisely.
No.
And the third gap, veterinarians being excluded from those high-level policy-making task forces.
Which seems significant.
It is, and these are really important details for you, the listener, to recognize.
Yeah, and it's crucial, I think, for you to understand why these specific gaps are so damaging. Things like not having quick tests for potential animal pathogens, or not having that vet perspective when big decisions are being made.
Right. It sounds like common sense when you say it like that.
Well, connecting it to the bigger picture of how we respond to pandemics, overlooking these areas isn't just a minor slip-up. It can fundamentally weaken the whole system.
How so?
Dr. Gurma puts it quite powerfully, actually. He says, excluding veterinarians from task forces is like fighting with one hand tied.
Wow. That really paints a picture.
It does. It really underlines how serious these blind spots are in our collective ability to prepare.
Okay, that's a really strong point on COVID. Now, let's shift gears a bit. Let's talk about Ebola. That's another major case study Dr. Gurma focuses on in our sources.
Right. His work with the Africa CDC, post-Ebola surveillance.
Exactly. And he found something really compelling there. His work showed that these community-led vet teams...
Teams on the ground, working within communities.
Yes. Those teams detected outbreaks a significant 30% faster compared to the more traditional surveillance systems.
30% faster. That's not a small number.
Not at all. It's a real aha moment in the data.
It really makes you pause and think, doesn't it? What does detecting something like Ebola 30% faster actually mean in a crisis?
Well, fewer infections, fewer deaths, presumably.
Absolutely. But think about the spread. Ebola spreads exponentially.
Yeah.
So saving those hours, those days, it's not just about the numbers directly affected. It's about reducing that overwhelming strain on health systems that are already, stretched incredibly thin.
Right. Less pressure overall.
Exactly. And it suggests that these kinds of innovative approaches, like using community-based vet teams who know the area, know the people, know the animals, they aren't just marginal gains.
It's a fundamental shift.
It's potentially a substantial leap in how effectively we can respond. That kind of speed, that 30%, it can genuinely alter the entire path of an epidemic. The ripple effects are huge.
That potential is undeniable. And Dr. Gurma's insights, they aren't just based on his field experiences, right? He backs this up with research.
Yes, published research too, in the Journal of Veterinary Public Health.
And there's a really compelling financial point he makes based on that research. He states it unequivocally. He says, every dollar invested in veterinary pandemic preparedness saves $7 in outbreak costs.
Wow. Okay, $1 in saves $7 later.
That's the finding. A 1-to-7 ratio.
Now, when you put that into the broader context, well, that specific ratio is incredibly important, especially for policymakers, for public health strategists, the people holding the purse strings.
Why is that ratio so crucial?
Because it tells us very clearly that investing proactively in veterinary preparedness, it isn't just good public health practice. It's fundamentally sound economic strategy. Full stop.
So it's an investment, not just a cost.
Precisely. It makes a powerful case for shifting resources away from just reactive spending, pouring money in after a crisis explodes, towards proactive investment that can actually stop those crises from getting so big in the first place.
It reframes the whole discussion.
It really does. It frames health spending as a critical economic necessity, not sort of just a humanitarian nice to have.
Okay, so if we pull it all together, the main takeaway from Dr. Gurmat-Kebedi's insights seems pretty clear.
Yeah, I think so.
There's this undeniable, absolutely crucial role for veterinary expertise in preventing and containing zoonotic outbreaks. And it's a role that's, well, often really underutilized.
Massively underutilized sometimes.
And the benefits are just stacked up, aren't they? The financial saving, that $7 saved for everyone spent, plus the operational gains like that faster detection, closing those critical gaps we talked about.
They're just too significant to keep ignoring.
It feels like it. Which brings us back to Dr. Gurma's sort of overarching mission, his philosophy.
Which he puts very concisely: see the outbreak before it sees us.
Right. And that really prompts you, the listener, to think deeply, doesn't it? What does it actually mean to anticipate future health crises, to get ahead of them instead of just reacting when they hit?
It's about building systems, right? Systems that can pick up on those very first whispers of a threat long before they roar into a full-blown emergency.
And Dr. Gurma actually has a direct challenge related to this for you listening right now.
Oh, yeah. What is it?
He basically urges you to share this deep dive. Just share it with one policymaker, someone who really needs to understand how vital veterinarians are in this whole pandemic preparedness picture.
Just one person spreading the word.
Exactly. So let's leave you with this final thought. Given all this evidence we've discussed from the sources, those critical gaps, the 30% faster detection, that really clear 1 to 7 return on investment, what do you think are the biggest hurdles stopping us from fully weaving veterinary public health into our global pandemic strategies?
And maybe even more importantly, what's your role? What can you do to advocate for these critical, often unseen front lines of public health?